As the virus continues its spread, we've decided to take increasingly aggressive steps to keep you and your family safe. We will be denying entry to Canada to people who are not Canadian citizens or permanent residents. Only 4 Canadian airports will be accepting international flights. Let me be clear. If you're abroad, it's time for you to come home. If you've just arrived, you must self-isolate for 14 days. And finally, all Canadians, as much as possible, should stay home.
Hi there and welcome to Power and Politics. I'm Vashi Capellos. We have the very latest for you tonight on the coronavirus pandemic and this country's efforts to contain the spread. The federal government has announced what it's calling aggressive measures at Canada's borders. This country is barring entry to all travelers who are not Canadian citizens or permanent residents. U.S. citizens will still be allowed to cross the border. Any Canadians abroad who are exhibiting symptoms will not be permitted to board a flight to Canada, and any incoming international flights will be limited to landing at one of 4 airports where they'll undergo enhanced screening. Provincial governments welcome the new rules, but at least one expressed concern over the U.S. exemption. Take a listen.
We're very strongly supportive of most of those changes. We note that we remain concerned that access from visitors from the United States continues to be allowed. Given the situation, particularly in King and Snohomish County in Washington State, which affects British Columbia more than anyone else, it's our strong view and it's our strong message that visitors from the United States not come to British Columbia. Don't come, because at this moment, that is the wrong thing to do. We understand that people are being asked to self-isolate, but better than self-isolate for visitors is not to come.
So why did the federal government exempt U.S. citizens? I'm joined now by President of the Treasury Board and Vice Chair of the Special Cabinet Committee on COVID-19, Minister Jean-Yves Duclos. Hi, Minister Duclos.
Hello.
Welcome back. Thanks for coming back in. Nice to see you.
Hello, Vashi, and hello, everyone listening.
Glad to see that you're healthy. I want to start off with that exact question. Why didn't the federal government close the border to American citizens?
So today's announcement is particularly important. It's part of a series of announcements that we've made in the last few days. Let me summarize very briefly before we come to the issue of our relationship with the United States. So first, just recently we've announced that Canadians should come home. We also announced that they should not travel abroad except for essential reasons. Yesterday we said that everyone traveling to Canada, regardless of who they are, where they might come from, needs to undergo a 14-day isolation. And today we've announced that our borders will be closed to overseas travelers except for Canadians. There are other measures that you've also mentioned around the concentration of facilities around airports, 4 airports, and also important measures that we haven't talked much about helping Canadians who are abroad and are very anxious and are frustrated sometimes with the services that they get from airlines because they can't come home. So we're also going to help them financially and in other ways. Now, our relationship with the United States is quite special. We are concerned, as many Canadians are, about what is happening south of the frontier. Now, we have a universal, freely accessible, free health service, which is making a big difference in the current situation, but that's not exactly what is happening south of the border. However, we also need to protect the arrival of essential goods that include pharmaceutical goods, important workers, and all sorts of other things that are essential to keep the safety and security of Canadians, and that's true also in BC.
I understand what you mean about the crossing of goods. Certainly, I mean, that's our food supply right now during the winter. But when it comes to where cases are originating, we saw, for example, the update from Ontario's public health minister, or officials rather, not too long ago. And they said of the 22 cases in the last 24 hours where they can identify the origin of those cases, half of them are from the United States. You heard the Minister of Health in British Columbia. They are telling U.S. citizens not to come to BC. Is there an incongruent message here? Why isn't the federal government saying the same thing?
Well, 2 things. One, which needs to be absolutely clear, and second, something which you might not know yet. The first thing is that all travelers from the United States, except for very essential workers, need to go through a 14-day isolation period starting now. So that means that a tourist who comes to Canada for no other reason than tourism will very unlikely want to spend a 14-day period in Canada. So they will stay home south of the border.
You're hoping that's the case.
That's mandatory.
You're not actually putting any regulations or rules in place
that
so that
is
it doesn't
demanded.
happen.
That is demanded. In fact, not only south of the border, but everyone coming to Canada, including Canadians, have to go through
I get that, but they can still come to Canada.
Well, they can come. They will be, of course, expected to follow, as everyone else, who followed that guidance. And of course, the second thing is that Minister Freeland, my colleague, that you also obviously know, is in contact and working very, very strongly with the BC government, because the BC government is also expressing all sorts of other concerns. Their relationship with the United States is absolutely essential for many of their essential services to operate. Now, healthcare in BC, in many contexts, there is a big integration between the healthcare systems. There are health professionals that cross the border that are useful on both sides of the border. So there are many essential things that we need to handle before we make further progress.
The Prime Minister, when asked about this today, said at the moment, you haven't closed the border to the United States or to American citizens. What is the line at which the government will decide to do so?
At the moment is exactly the key phrase, because as you've seen again today,
but what more do you need to see before making that decision?
So as you've seen, and as we've seen in the last few days, there have been at the moment action and at the moment announcements. And given the great importance of our relationship with the United States on all sorts of ways, at the moment will come when at the moment comes. And that will come after we do our due diligence, our important work with both the province of BC and other provinces, obviously, and with the American government.
But you're not ruling it out?
Nothing is ruled out. We will do everything we need to do to protect the health and security of Canadians.
Your government often, when asked in the past about why it wasn't doing more at the border, referred to the science, that the science wasn't there. And I want to read specifically what just on Friday, Health Minister Patty Hajdu said. I think Canadians think that we can stop this at the border, but what we see is a global pandemic, meaning that the border measures actually are highly ineffective and in some cases can create harm. So why on Friday did the science support not doing more at the border, but on Monday, just 2 days later, it led to a completely different decision?
Two things. What she meant is that the focusing exclusively on border measures would be ineffective.
She didn't say that, with respect. She didn't say that. She was asked a general question about why isn't the government doing more at the border? And
she was also saying that because some countries like Italy focus almost exclusively on closing borders. The second thing, which was also announced yesterday, is that Public Health Agency, which regroups all of those great health experts that we have the privilege of having in Canada. They announced yesterday that they were advising Canadians not to travel to anywhere in the world. So that's a strong health statement, which led to our decision of if Canadians shouldn't travel abroad because it's becoming becoming clear that everywhere on earth it's becoming very challenging.
Wasn't that clear with respect? Wasn't that clear last week? We knew the epicenter of this disease, this virus, had gone well beyond China and was in Europe. We knew that.
But the evolution has changed. If we were meeting a couple of times in the last week, and it was a pleasure always for me to be there. But if we had talked about this a week ago, we would have said very different things. The situation is going so quickly, it's changing so quickly that not only are the events, but also the reactions changing also.
But this is a very different reaction than your government has had in the past. You insisted, when questioned, that the science did not support closing the borders. Does the science now support closing the border?
According to the Public Health Agency officials that you would have heard perhaps today, Dr. Tan and all of her great experts and the wonderful team that also find elsewhere across provinces and territories, that's what they now say. And what they will say in the few days...
She recommended closing the borders in the way that happened today?
Exactly. And what you will say and what you will see in the next few days, because the situation will keep evolving, is, as you also alluded to, there will be other actions and other reactions. We need to be fully on top of our objective of protecting the health and security of Canadians.
My question, I guess, what I'm trying to underline is, should this decision have been made earlier? We knew from the start that, I know community transmission is the big concern in Canada, but we knew that what we were seeing of the initial cases were all related to travel. Should the decision to bar some travelers from entering this country have been made sooner?
We have always made our decisions based on the advice and the evidence provided by the amazing public health experts we have the chance of having in Canada. It's not everywhere in Canada that you have the quality of this expertise. So we will continue to do so. However, as you say, and as you obviously understand, and as all Canadians understand, that advice is evolving as the situation in Canada and outside of Canada is also evolving.
So when did public health make the recommendation to your government to close the borders in the fashion that it was announced today?
We had a number of important discussions over the last few days. We had another cabinet meeting just last night. We have every morning a meeting of the cabinet committee on the coronavirus. So it's not as if we speak about these things one day and we don't do anything else outside of it. It's a continuing evolution. We are advised and we are warned. We are warned indeed. We are also advised based on not only the current situation, but what they might be coming, and therefore planning for the worst while hoping for the best.
What about the communication to travelers who are coming back? I know that you said Dr. Tam talked over the weekend about self-isolation, but she actually initially said that on Friday. She suggested that that was something that people who left this country when they returned would have to do. Why was it not immediately communicated at airports? We saw massive lineups. We've heard from countless Canadians who received no instruction about self-isolation. Did your government miss the mark there?
Well, two things. The guidance and the advice and the directives were very clear. Of course, that changed over time because we were focusing on at-risk countries, then on at-risk countries, and also focusing obviously on Canadians who thought that they could have been in contact with infected people outside of Canada. Yesterday, the announcement is about every traveler coming from outside Canada. They need to self-isolate for 14 days. So there has been an evolution as a situation.
But I mean, on Saturday, Minister Champagne was saying, come home. So you've got all these Canadians, understandably so, trying to get home, getting on planes whenever they can. The airports are really crowded. We saw lots of people in lines in very close proximity to each other, and no specific instruction until late last night, is my understanding, to self-isolate, to know that the dangers associated with the travel that they had undergone.
So it relates to a series of announcements and actions that Canadians have been following with great speed over the last weeks and over the last days in particular. So the advice for Canadians to self-isolate, follow the advice to Canadians to come home, follow the advice to Canadians not to go abroad, follow the advice to a number of people coming to Canada. They would need to either self-isolate or not to come at all.
But is there some responsibility of your government in the situations that we saw at airports over the weekend? Do you not bear some responsibility for not quickly enough getting that message to returning Canadians?
Governments will always need to be at the top of their actions, and unfortunately there might have been instances, and the world isn't perfect, when there might have been a few people not doing the things they should have done, which is to tell the agents that they had been in contact or they were coming.
But they weren't being asked the question.
Well, the border agents also had that duty, but I'm not blaming anyone because it's a big crisis. Everyone is overburdened. We need to invest even more in resources in supporting agents, border agents that do a remarkable job, but also to support Canadians who are concerned and anxious, in particular about those that will want to come to Canada and that are facing very difficult challenges these days.
Okay, I'm going to leave it there. I'm out of time. Thank you, Minister Duclos. I appreciate your time as always this evening. That's Treasury Board President Jean-Yves Duclos. The federal government announced today some more aggressive measures at the border to combat the COVID-19 spread. Only Canadian citizens and permanent residents will be allowed to enter this country. The U.S. is the only country exempt from those restrictions. But will they be effective? Should they have been put in place sooner? David Collinette was the Federal Minister of Transport from 1997 until 2003. He joins us now from what looks like his living room. Hi, Mr. Collinette.
Hi, Vashi. Yes, I'm in self-isolation here, having just returned with my wife from Ireland.
How are you guys feeling?
Well, we've been overwhelmed because we've been with our grandchildren in Dublin, and we've been watching things unfold in Europe, nightly watching the BBC and RTE in Ireland. And I have to tell you that the European continent is really gripped with the issue, and people are becoming quite alarmed.
How's your family doing?
They're fine. The kids are all off school. They thought it was great. But 2 weeks from now, 3 weeks from now, I'm not so sure.
Good point. Let me switch gears and ask you, Mr. Colonnet, about the measures announced today. You, of course, as I read that introduction, we should make our viewers aware, of course, you were the transport minister during 9/11. You know what...
And during SARS as
and
well.
During SARS, yeah. So you know what extraordinary measures are all about. How extraordinary was the decisions announced today? Were the decisions, rather, sorry.
Well, it's extraordinary, but it's the right decision. People can say, well, should have been done earlier. We can't quibble about that because this disease has taken everybody by surprise worldwide. And I don't think we can criticize governments for acting in a certain way or not in a certain way. One never assumed that something like this would happen. Certainly with SARS, it was well contained in Toronto and Vancouver. And so we didn't have quite the international breadth and the disease affecting so many people.
How did what happened then, and even at 9/11, the considerations that you had as transport minister then, how does that compare? I know you just touched on it, but how does that compare to now, do you think?
Well, there are similarities, but there are a lot of differences. In 9/11, you're talking about an organized plot by human beings, terrorists, who wanted to destroy buildings in New York and Washington and kill thousands of people. Here, we're talking about an insidious disease that no one really knows much about. So it's one thing to go after terrorists. It's another thing to go after a disease that you've never seen before.
And let me ask you particularly where I think the government got a lot of questions today, and that is why are Americans at this point exempt from the restrictions that they placed on people coming in from other countries. And most ministers pointed repeatedly to the integration of our two economies and the goods and the sort of essential services going back and forth over that border. Take me a bit through what the calculation might be around the cabinet table when it comes to the border that we share with the United States.
Well, as Minister said this afternoon, we do work with the Americans on a day-to-day basis. They are our greatest friend and neighbor. And so I think that was the right decision. Many Americans are on Canadian flights and then transit to the United States. On our flight on Saturday, there were a number of Americans going on from Toronto to points in the U.S. So that's acceptable. But I think people should realize that the danger here is not so much for Americans coming to Canada, it's to try to get all of our people back home, especially in the United States. We all have friends, especially in Florida, California, who now are being forced to drive back. They flew to those places. And, we want the border to be open for our own citizens to come back and not have any hassles. So we work with the Americans and develop a coordinated approach.
And what do you think a coordinated approach entails?
A coordinated approach, as the government said, is that you have to fill out questionnaires or answer questions. Do you feel sick? There should be some testing done. Certainly in SARS, I believe under the Quarantine Act, there were officers placed at Toronto and Vancouver airports to actually test more rigorously those people who were obviously sick or felt ill. And that worked. There were millions, actually, that went through by about August 2003, passengers, and they filled out questionnaires. About 9,000 had full medical examinations, and I think very few, if any, actually tested for SARS. This is a bit different because of no one really knows that they're actually carrying the disease because the symptoms don't show up until much later, and they may not be that much different from flu, which you get every year.
We know that obviously, and we've been discussing the potential health effects of all of this, but there are guaranteed going to be really big economic effects as well. And we know that the airline industry in particular is going to be hit hard. They've already talked a bit about it. Capacity is way down. What kinds of conversations do you think are going on with the airlines? And do you expect that the federal government will have to offer some financial help?
We had to be very tough on that after 9/11. The federal government still owns all the airports. Local authorities manage them under the Canada Airports policy. The same with the ports. But the government had to underwrite, because all the insurance companies, with all the loans that are out there to finance port construction, airport construction, they wanted to know that they were going to be paid. And so the government agreed to indemnify any losses that would be incurred at the airports if they couldn't pay their interest payments on all the loans. When it came to the airlines, we were pretty bloody-minded and said, look, we can cooperate, but we're not going to give compensation. And a few airlines went under. It made it extremely difficult for the national carriers, in particular Air Canada. Then they had SARS to deal with, and they've just recovered, really, and I guess in the last 10 years, since 2009. So I'm not sure the calculus that's going on in the current context, but the airlines are really cutting costs now. Perhaps the government will agree to give some compensation. I noticed today Mr. Garneau said there was discussion about compensating individuals that can't get back home. 9/11, the interruption wasn't as long as this one will be. This could be very long. This could be 2, 3 weeks, 4 weeks before anybody could get home. So there maybe is a different set of circumstances. But after 9/11, those people who were stranded around the world who couldn't get back because all the planes were not operating, there was no compensation given by the federal government at that time.
Do you think, you mentioned, but do you think the calculation is a different one this time? Should it be?
Yes, I mean, you're talking about, millions of people that are affected worldwide, and probably millions of Canadians that have been traveling in the last couple of months. And, we've heard from friends that are, stuck in France, they're stuck in Colombia in South America, they're stuck in Puerto Rico or Costa Rica, as well as the United States. And so this is the enormity of this situation affecting Canadians, and the length of time it may take to get them back is going to be, I think, a bit different than 9/11, after 9/11.
Okay, I'm going to leave it there. Really appreciate your insights this evening, and I'm wishing you and your family abroad the best of health.
Thanks, Vashi.
Thanks. That's David Collinette, former federal Minister of Transport. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.